Okay, so yeah, welcome and for inviting me. So I'm a professor work and organizational psychology at the Erasmus University of Rotterdam, and of course I teach there. So I give courses, for example, occupational health psychology, introduction, occupational psychology in general. I now teach also about individual differences, personality, cognitive ability, and besides teaching, I also do research, and I have different lines of research. So one thing I do is on fatigue. So when you work, you get tired, or when maybe some people have chronic fatigue. So what is it, and what are the consequences? Where does it come from? I do research on flow. So I'm not sure if everybody is familiar with flow, but flow is like, for example, when you're gaming and you're really into the task. You forget the time, you forget everything around you, and that's what they call flow. I think most people know that. But we study, okay, what's going on in the brain when people are in a flow. So these are fatigue, flow. This is kind of experimental research. I also do a lot of research on personality or cognitive ability, and then it's about what kind of factor structure is there in personality, and how does it relate to many outcomes such as job performance, popularity, social relationships. So it's about personality in general and how it relates to many outcomes. So this is, in terms of the research, most of the things I do. And of course I also have some other jobs, like I work in journals as an editor, for example, in personality, individual differences, or acta psychologica. Okay, so some of these topics, kind of are on my way. Yeah? So for example, I did my master as experimental psychology. So it's about cognitive psychology, about how the things in the brain work. But then after my master, I was looking for a PhD position. So in the Netherlands, here I think you are a student when you're a PhD student. In the Netherlands, you kind of apply for a position at a project. Then you start to become a PhD student. And so I searched for a project and on a nice topic. And one of the topics on the project was about fatigue. So it was not a thing I did before, but it was I applied after my master on this topic, which actually was in work and organizational psychology. So I shifted from cognitive psychology to work and organizational psychology to work in this project on fatigue. So this is how I came in touch with that topic. And then once you are at the university, so most of the time you continue with the topic you work on, but you also can have new topics. And so during my course of the university, at the university, I switched some part of it to personality. I did something on flow. I did many other things with other people, like occupational health. So there are many things that you can do if it gets your interest, or if you collaborate with other people. Yeah. So that's how a topic evolves actually. And of course, but fatigue is one of my earliest topics. That's how I started as a PhD. Yeah, it's a mix. So some projects are like the fatigue. I just came in the project, and then you kind of have to work on the topic. But over the course of time, when you work on a topic, it also becomes your own topic. So then, you get into it, and then at some point you also have other interests, and then you kind of also pursue these other things. So that's how it goes. And fatigue is one thing that I did it in the beginning. Most of my research was on fatigue, and now it's one line of research next to other lines of research. Okay, so first, kind of a bit about fatigue in general. So fatigue is of course about being tired. So it's a word, an English word for being tired, and so it's a very common phenomenon. It's not like everybody is tired. When you work a hard day, then you feel tired. If you do your homework, if you have to learn a lot, a couple of hours, at some point you get tired. And so it's a very common experience. But if you really want to dive into it and really want to understand what it is remarkably complex. So it's it's like what are the processes that play a role in when people get fatigued? What happens in the brain when you get fatigued? And it seems very simple, but it's not so simple. So for example, in the early days, what people thought is that, okay, fatigue is something like they have a level of energy, like a battery, yeah? You have a level of energy, and if you work, you spend that energy, and then at some point, the energy is kind of, the battery is almost empty, and then you feel fatigued. But the thing is that that's not how it works. Because sometimes people, they don't work for so long and they still feel fatigued. Sometimes you can work for many hours without being fatigued. So it's not that simple. It's a very complex process actually. So task disengagement is, you have engagement, that you're really into a task where you work on something and you really feel like you're really into it, like flow, for example. You can have flow, or you can have really something that you really enjoy or that you're really attentive to. But of course, if you are fatigued, then the thing is that becomes more difficult by definition. I mean, the definition of fatigue is that you actually want to stop. So we also, in terms of the definition, we also sometimes refer to fatigue as a stopped emotion. And so, I don't know if you understand what it would refer to. So for example, people have all kinds of emotions or feelings. So hunger, what is hunger? Hunger is a emotion or a kind of a feeling you have that urges you to eat. When you sleep, you're sleepy, you want to sleep. So it's a motivation for you to sleep. And fatigue is probably a motivation to stop doing what you do. So it's a kind of a feeling that the brain has to say, okay, now you're spending much time on this task, or you're doing something, it might not be very useful to continue, maybe you should stop. And then most of the time we feel that as fatigue. Sometimes it's just motivation, but we feel that most of the time as fatigue. So the experience you have when you work on a task for a very long time and your body says, maybe you should stop. And so the idea is that fatigue has many symptoms. So what is fatigue is that you have a certain feeling of not wanting to continue. That's actually so there's an urge in your body or in your brain that you want to stop doing the task. But sometimes you really have to do the task. So for example, if you working on your homework and you have an exam the next day, you can't stop and you want to stop. So and then there is a kind of you really want to engage, but your body says no, disengage. And so that's why it's also very stressful to continue working under fatigue. Yeah, so the idea, because it's such a complex state, you wanna look at different things. So one is that you can ask people how fatigued they are. So I mean it's a state, so people report, people know how fatigued they are, how hungry they are. That's one thing you can measure with questionnaires. You can have a task and then you can let them work on a task for 1 or 2 hours, and then they just can, at some point they say, well, I'm fed up, I feel this level of fatigue. But you want to also look at, does it change their behavior? And sometimes with fatigue research, what you see is that sometimes it goes together. If people become fatigued, their performance declines. But also many times you see that people report a lot of fatigue, but the performance still is quite okay. And then you can see that there might be regulatory mechanisms going on in the brain. So with the example of your homework, so you cannot stop, but you feel fatigued. So you actually can force yourself to stay on the task, but it comes with some cost. So for example, you might get more stress, so your body gets activated, or you might see something in the brain that shows that you actually are working very hard to kind of counter your feelings of fatigue. So it's interesting to see how all these things work together. So then you look at how people feel, how people behave, but also what happens in the brain. And regarding the brain, there are different things you can look at. But one thing that we wanted to know is that there's also a specific area in the brain that plays a role in decisions on whether to continue or not. So, because you have to think everything you do the whole day, your brain constantly makes decisions. Do I engage in this task or do I do something else, right? So even if you go in this podcast, or if you make a small decision, look at this side or look at there, or I mean, it goes, most of these things go automatically, but your brain makes the decision to do something. And in doing that, it always makes cost-benefit analysis. So it always kind of calculates, more or less, like a machine. So, okay, what do I do? How much does it give me? And how much does it cost me? And then if the balance is unfavorable, then it might decide not to do something. And so what happens in fatigue is that you work on a task, and you work on a task because it gives you something. It gives you a reward. If you learn for the exam, then hopefully it gets you past the exam. But the longer you work on it, there's also more cost. And so, for example, well, you spend like energy, like it might be something like energy maybe, but also you spend time on a task. And as an organism, like as a human, but as an organism in general, you spend some time on a task, but you should not spend all your time on the task because you have other things to do. So there's also kind of a mechanism that prevents you from spending much time on the same task. And so if you work on a task a very long time, then at some point your body says, well, maybe it's enough, maybe you should stop. But you will not stop because you have to learn. And then you get this struggle. And so what we want to know is which areas of the brain are involved in that process also. And there's one thing they call it the locus coeruleus. There's one part of the brain that plays a role in making these decisions. Kind of, if it says, well, okay, this is a task you can engage in, then it prepares your brain in such a way, because it has a very broad influence on the brain, it prepares your brain in such a way that it makes it easier to focus on the task. And if it's decided, well, maybe you should stop, then it becomes more difficult. You still can, but it costs you more and more effort to kind of force your brain to keep focused. Whereas the other processes, now you should stop actually. Yeah, so it's a mix. So what you want to do is, if you have three types of measurement, behavioral, subjective and physiological, it's not that you can't detect it, but it just, you want to see how they interact with each other. Because as I said, sometimes you see that people report a very high level of fatigue subjectively, but the performance stays the same. And so then you should ask, okay, well, if that happens, okay, what's going on? Do they only report that they are fatigued? Maybe they just want to stop the task, or is it really that they are fatigued? And so you don't know. So then if you look at the brain, you can still have more information. You can see, okay, so we see that they still perform quite well, they report high levels of fatigue, but over the course of the time, you also see that in the brain things change. And they change in such a way that it's indicative of this kind of struggle that's going on in your brain between having to force yourself and the other processes saying, go away. Yeah, so pupil dilation. So the idea is that you have this area in the brain, this locus coeruleus I talked about, and it's responsible for adrenaline in the brain. So it plays a large role in arousal. So for example, if you're in a bar and you meet somebody who you like, then your pupil gets wider because you get aroused, get interested in it. So it's a process, and they in the early days they said, okay, this core, it plays a role in arousal, but nowadays we know that it's more complex. It's not only arousal, but actually also the decision to engage in a task or not. And so the idea, what they have with this pupil dilation, is that it reflects the activity partly of this core in the brain. Because the core in the brain, it's difficult to measure. You can probably use fMRI, maybe it's not so easy because it's very deep in the brain. And so you need indirect indicators. And this pupil dilation, how people respond to things that are going on in the task, actually reflects, is assumed to reflect the activity of that system in the brain. So you can't measure it directly, but then you have to measure it indirectly. And so because we all actually also combine it with another measure, like brain measure, like EEG. I'm not sure, EEG is that you see for brain waves. And there are also certain waves in the brain that happen when people work on a task. And again, it's the same. So people say that certain waves also reflect the same brain area. And then we have the pupil dilation and the waves in the brain. And then again, you can kind of validate it. If they both show the same pattern, then at least you don't have one measure, but you have two measures of the same area in the brain. So that's why we do it. And that's, yeah, it's a way of studying fatigue and what's going on in the brain. And this is, what we actually do there is mostly, they call it acute fatigue. And acute fatigue is actually that fatigue that happens when you are working on a task. So you're kind of a healthy person, but you go to the lab, and then we ask you to work on a task for 2 hours, and it's a very attentive task, and then at some point people get fatigued. But you also have what they call chronic fatigue, and sometimes we also study that, and it's a bit of a different area. Yeah, so burnout is also one of the major characteristics of burnout, that people are very fatigued. And so it might not be the same as the acute fatigue, but it's also a type of fatigue. And then you study, okay, what's going on with those people? Do they also show some difference in their cognitive processes, for example? Yeah, so I think several things that we did. We did a lot of studies, but in terms of the main conclusion, one of the things that when we started, there was the idea, okay, so when you get fatigued, things get more difficult. That's not so exciting. I mean, everybody knows that. But the idea, the question was, okay, what kind of processes are particularly sensitive to fatigue? Because in the brain, you have like a process that they call a controlled processing, like executive functions inhibiting certain things, and you also have more automatic processes. And well, we expected that mainly those more demanding cognitive processes would be sensitive to fatigue. It seems a very obvious idea, but it was not really tested that well. So one of the early things we did, it was that showing that actually that is true, that particularly this cognitive processes, this control processes were more sensitive to fatigue. So what does it mean? Well, it means that if you have things that you can do very automatically, even when you get fatigued, they are still working quite well. But particularly when something is unusual or very different from what you kind of used to, then you need this control processing. And then when you fatigue, it has a higher probability that something can go wrong. That's one thing. And the other thing is more about the role of this locus coeruleus. It's kind of a very specific theory, but it was one of the ideas that this might be involved in fatigue, because there are general theories about how this brain area works. And so we expected also that, based on what we know from the general working of this area, that it might also be involved in when people get fatigued. And so the other finding, for example, the study on the disengagement, was actually related to showing that having indications that this process is involved in fatigue. But these are the two main things, I think, from the acute research on fatigue, or the research on acute fatigue. Yeah, so it's always difficult to have it exactly as an application, but the idea is, of course, that if you know better what kind of errors people make when they are fatigued, then it would also be able to better anticipate where people make errors if they are fatigued. So of course, yeah, sometimes, for example, if you drive, you know it's more related to sleepiness, but you know what kind of behavior people have when they get sleepy, and then you can prevent that by kind of anticipating on what people might do when they get sleepy. And here it's the same. So you have, if you know what cognitive processes are involved in fatigue, you might be able to think, okay, if people work during a day, particularly when the task is like this, when it puts a lot of demands on the controlled processing, then people are more sensitive to making errors. So it's like theoretical knowledge, it's a more fundamental research, but you can use it to kind of anticipate where the errors are. And this is mainly again in the fatigue research, in the acute fatigue research. And also when we do research on chronic fatigue, like in burnout, then it's more like a clinical application. So you want to find people who report a lot of fatigue, that you say, well, if I'm burnout, I can't really do anything because I'm after 1 hour I'm completely exhausted. And then we want to know, okay, what's going on in their body? Why are they so very fatigued? And then, for example, then we look at, do we find a lot of stress hormones in the body? Or do we see that they actually also are very prone to certain errors? There it's more the clinical relevance in that type of research. That's a thing, eh? So it is, of course, in the early nowadays, each study has to be passed the ethical committee, and of course, so you have to ask for it. But in general, I mean, it's still okay. So people work for a time, and then of course they get fatigued, because that's the idea. We try to make them tired, and they actually will get tired. But yeah, that's I mean, there's no lasting effect or something, and most of the time, well, the research goes quite well. And it's also amazing that you would say that, for example, if we use students as participants, you have the idea, okay, so maybe they work on the task and they get some points for participating, but maybe at some point they're kind of fed up and they don't want to do the task anymore. But often what you see, what happens, is when people invite the people in the lab and you let them do the task, they're still quite motivated to do the task. They're still quite motivated to comply and to kind of work on the task and do it for as long as they can. So that actually also works quite fine. To be honest, there are maybe 1 or 2 cases in all the people that I tested where people really stopped. They were fed up, and of course they can always stop when they want to. And I think there was one person that actually got really mad. After 1 hour, she said, well, I don't want to do this anymore, and it's ridiculous, and I don't know what's going on. But yeah, this person didn't like it that much. But overall, I mean, it's quite okay. I mean, it's the same like if you study stress, for example, and also you see people get stress induced. So that means it's more or less the same. Eh? So people don't feel very comfortable, but afterwards, when the experiment is over, you explain to them what happened, and then they take some rest, and then everything hopefully is okay again. But I think in general, I think you can also look at yourself. Eh? So, for example, if you would be invited to participate in an experiment, and maybe you get even some points for it, or some money or whatever, then probably when you would do it, you would be willing to kind of do your best. I mean, most people are like that. So most students, I mean, there might be people that really don't like it, and they have to participate because of their study points. There might be some people like that. But most of the time when you invite people in the lab, they do that. And if they do a task, a very kind of demanding task for 2 hours, then they probably also do many other experiments. Actually, they quite like it, some of them, do kind of study. Yeah, thank you for inviting me. Yes. Okay.
Lead and innovate.